Hi, I'm Dr. Eddie Hooker. I'm a professor at Xavier University in Health Administration, and I'm an emergency physician at the University of Cincinnati Medical Center. I'm here today to talk to you about the new way to do CPR. CPR has been around for a very long time, but we've changed the way we want you to do it, and we're going to save a lot more lives if you'll listen to these very simple instructions. The problem with CPR is if it's not started before EMS gets there, patients don't stand much of a chance of survival. About 80% of cardiac arrest occurs actually in houses, about 20% in public places. EMS takes 10 minutes or so at least to get there, and if you wait that long for CPR to be started, the patient stands almost no chance of survival, less than a few percent. But if you will start CPR, bystander CPR, you can increase that survival up to maybe as much as 15 to 20%. So let me tell you about the new way to do CPR. It's called hands-only CPR. And what we've changed is a few things about it. Why don't people do CPR? We address those in this new way to do CPR. People are afraid they'll do CPR wrong. They'll do mouth-to-mouth wrong or compressions wrong. First of all, there's no wrong way to do CPR. The only wrong thing you can do is not start. The person is dead. Anything you can do gives them a chance of coming back to life. So I need you to start compressions. But a lot of people also are afraid about doing mouth-to-mouth. They don't want to blow on a person and they don't want to give them mouth-to-mouth. And I can understand that. And that's why we've taken that away from you. You don't need to do it. In fact, we've shown that it actually decreases survival. Giving mouth-to-mouth only gives the patient a little bit of oxygen because there's just not that much oxygen in your lungs. So we want you to stop trying to do mouth-to-mouth. When the EMS arrives, they'll start giving the patient 100% oxygen. But before that, we only want you to do compressions. The other thing is a lot of people are nervous that they might get sued if they do CPR. There's Good Samaritan laws in every state that protect you from being sued. So just do it. Don't worry about if you do it perfectly because any CPR is better than no CPR. The final thing we also took away is the pulse check. A lot of people were nervous about trying to check and make sure the pulse wasn't there. You don't need to check that anymore. If a victim of cardiac arrest, it's either a teenager or an adult, is not responding and is not breathing, you just start compressions. There's this kit that I'm holding that's available through the American Heart Association that you can buy yourself if you want to. It's $40 and works very well for you to learn how to do compressions, but you don't even have to do that. But let me show you how to do compression-only CPR. It only takes a few seconds to learn. So all you do is, here's a mannequin, simulating a real person. You just shake them, say, hey, can you respond? They don't respond, they're not breathing. You can put your hands in the center of the chest, put one hand on top of the other, and start CPR. You want to do it really fast to the song Staying Alive. Bum, 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 bum. Staying alive, staying alive. You want to do it as long as you can do it. If you have nobody else with you, you may have to dial 911 before you start. If you don't have a phone, start CPR. If you have someone else available, tell them to call 911. But remember, this chance of this person surviving has everything to do whether you start bystander CPR. So let's do CPR the new way, hands only, and save some lives. Thank you very much.